Have you ever stood in your kitchen at the end of the day, looked at a single clove of garlic, and wondered if all those health claims you've heard are actually true? Some videos say garlic can lower blood pressure overnight. Others claim it cleans your arteries, boosts your immune system, helps you sleep, or even slows aging. Search online and you'll find one person calling it a miracle food and another saying it does nothing at all. So who's right? Tonight, instead of adding another opinion to the pile, let's follow the science and your body. We'll walk through what actually happens after you eat garlic before bed. Not what social media promises, but what researchers have actually observed. Some changes begin within the first few hours. Others take weeks of consistency before they become measurable. And a few of the most popular claims still don't have strong evidence behind them. We'll also cover something many videos leave out entirely. For some people, eating garlic before bed may not be a good idea at all, especially if you're taking certain medications or living with specific health conditions. So before you decide whether this nightly habit belongs in your routine, let's separate the facts from the myths. But first, a quick reminder. This video is for educational purposes only. It isn't meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. If you're taking prescription medications, especially blood thinners, or medication for diabetes or high blood pressure, please talk with your doctor before making significant changes to your diet. Now let's begin where this story actually starts. Not in your heart or your blood vessels, but in that small white clove sitting on your cutting board. Whole garlic is far less active than most people think. The compound everyone talks about, allicin, isn't even present inside an intact clove. It only forms when garlic is crushed, chopped, or chewed. Picture garlic as a tiny sealed container holding two separate ingredients. As long as the clove stays whole, those ingredients stay apart. The moment you crush it, they mix, triggering a reaction that creates allicin. That's why freshly crushed garlic smells so strong almost instantly. In a way, that aroma is a sign the chemistry has already begun. There's a twist, though. Allicin doesn't last long. Researchers have found it's unstable and breaks down within minutes into several other sulfur compounds, and scientists believe those compounds are responsible for many of garlic's biological effects. Allicin, in other words, is more like a spark than the final product. This is also why researchers study fresh crushed garlic differently from cooked garlic, garlic powder, or aged garlic extract. They are related but not identical, which simply means they may behave a little differently once inside your body. So why do so many people recommend garlic specifically at bedtime? This is where the internet tends to get ahead of the science. There isn't strong clinical evidence that nighttime is biologically better than morning, and no major medical guideline recommends bedtime specifically. Part of the appeal is simply practical. Dinner is often the last meal of the day, which makes an evening habit easier to remember, and some people find garlic easier to tolerate once the stomach has had time to digest a meal. What researchers actually care about isn't the clock. It's consistency over time. If you're expecting one clove tonight to transform your health by tomorrow morning, the science doesn't support that. When effects do show up, they tend to build gradually. So what actually happens in those first few hours? Imagine you eat one clove of freshly crushed garlic this evening. The first organ to notice isn't your heart, it's your digestive system. For many people, nothing unusual happens. For others, especially with sensitive stomachs, raw garlic can cause a warm sensation, mild discomfort, bloating, or acid reflux. These aren't rare side effects. They're among the most commonly reported experiences in clinical studies. Natural doesn't always mean gentle. Your body still has to process a genuinely potent food. As digestion continues, the sulfur compounds formed from allicin begin entering your bloodstream. Researchers believe some of these interact with the delicate inner lining of your blood vessels, called the endothelium, essentially the smooth, active tissue that helps regulate how blood flows through every artery in your body. Some laboratory and human studies suggest garlic compounds may support this process by influencing nitric oxide, a molecule involved in relaxing blood vessels. May support, researchers say, carefully, not guarantees, and certainly not overnight transformation. These changes are happening on a microscopic level. You won't feel your arteries relaxing while you sleep, and you won't wake up tomorrow feeling 20 years younger. That's actually good news. Real health improvements tend to happen quietly and gradually, not dramatically. So if the first night isn't about miracles, why have scientists kept studying garlic for decades? What changes after weeks of consistency that makes researchers pay such close attention? That's where the evidence gets a lot more interesting, and that's exactly where we're headed next. So that's night 1. But almost nobody asks about night 1. What people really want to know is what happens if you keep this up for a month, or 3 months, or a year. That's where the research actually gets interesting, because this is the part scientists have spent decades measuring. Let's start with blood pressure, since it has the strongest evidence behind it of everything we'll cover tonight. A large 2026 analysis pooling more than 100 clinical trials, involving over 7,000 people, found that regular garlic intake was linked to an average drop of about 3 to 4 points in systolic pressure, the top number, and roughly 2 points in diastolic, the bottom number. I want to be honest with you about what that means. 3 or 4 points won't replace a prescription. It's not dramatic. But sustained over months, changes that size are considered clinically meaningful by cardiovascular researchers, especially layered on top of the habits your doctor has probably already recommended. Remember that endothelium we talked about earlier, the lining inside your arteries. This is where it comes back into the story. Researchers believe garlic sulfur compounds help those vessels produce more nitric oxide, the same molecule your body already uses to relax and widen blood vessels on its own. Garlic isn't forcing anything. It may simply be nudging a system you already have toward working a little more efficiently. Now, cholesterol. This is where I want you to lean in, because the story here is genuinely mixed, and I'd rather tell you the truth than sell you a clean answer. Some of the larger recent analyses found real drops in total cholesterol and triglycerides with regular garlic use, in some cases around 10 points on total cholesterol. Encouraging on the surface. But when researchers isolated the highest quality studies, the ones that tightly controlled for diet, so garlic was the only real variable, that effect shrank considerably, and in several analyses it stopped being statistically significant altogether. One well-known review, published years ago in a major internal medicine journal, put it plainly: garlic is probably better than nothing, but the effect is modest, and how reliable it really is remains debatable. So what do you do with that? I don't want you thinking 1 clove a night is doing the work of a statin, because for most people with meaningfully high cholesterol, it isn't. What the evidence does support is garlic as one small, reasonable piece of a heart-healthy pattern, not a replacement for the bigger picture. There's a third piece here that rarely gets mentioned: circulation itself. Several trials have measured how easily arteries expand and contract as blood moves through them, a marker of vessel flexibility. Garlic compounds appear to support that flexibility, and some research has tied this to modest circulation improvements, particularly in people who started with some arterial stiffness. If you deal with cold hands or feet, or you've been told you have some hardening of the arteries, this is likely the mechanism your doctor is referring to, if garlic has ever come up in that conversation. Here's the part I don't want you to skip past. If you're already on blood pressure medication, adding something that also lowers blood pressure, even modestly, isn't a decision to make quietly on your own. The danger isn't garlic itself. It's 2 things pulling in the same direction without anyone tracking it. We'll come back to this in more detail before the video ends, because for a lot of you watching, it matters more than anything else tonight. For now, sit with this question. If garlic is doing something measurable to your blood vessels and your blood pressure over weeks, what's it doing to your immune system and to the part of your body that has to break it down every single night, your gut? That answer might surprise you, because some of what people assume about garlic and immunity isn't nearly as settled as you'd expect. I want to slow down for this next part because it's where most health content, not just about garlic, gets ahead of the evidence. So let's separate what's actually proven from what's still just a promising idea. Immunity first, since it's probably the claim you've heard the most. Garlic has been called a natural antibiotic for generations, largely because lab studies show allicin can act against certain bacteria and viruses in a Petri dish. That part is real. But a Petri dish isn't a human body, and this is exactly where the evidence thins out. The National Center for Complementary and Integrative Health, part of the NIH, reviewed the research on garlic and immune support and found surprisingly little quality research has actually been done in real people. A 2022 review could only find 2 studies suggesting a possible benefit, both small, both with real limitations in how they were designed. What about garlic and the common cold specifically, since that's usually where this claim ends up? A Cochrane review, and Cochrane is about as rigorous as medical research review gets, looked at this directly. Only one trial met their standard, 146 people, half given garlic, half given a placebo for 12 weeks. The garlic group did report fewer colds, 24 occurrences compared to 65 in the placebo group. That's a genuinely interesting result. But it's one trial. Cochrane's own conclusion was that there isn't yet enough evidence to say garlic reliably prevents colds. One promising study isn't proof. I think that distinction matters, especially if you've been burned before by a supplement that promised more than it delivered. Now your gut, which is quietly one of the more interesting frontiers in garlic research right now, even though it's still early. Studies, mostly in animals so far, with some early human research, suggest garlic can shift the balance of bacteria in your digestive tract, in some cases increasing beneficial groups like bifidobacteria. One mouse study found garlic supplementation helped offset some of the negative gut changes caused by a high-fat diet. Encouraging groundwork. But we don't yet have large, well-controlled human trials proving garlic reliably improves your gut in a way you'd notice or feel. This is a watch this space area of science, not a settled one, and I won't pretend otherwise. And then there's sleep, which, based on how many of you have shared your own sleep struggles in comments on videos like this one, might be the thing you actually came here hoping to hear about. So let me be completely honest with you. I could not find direct, well-designed clinical trials testing whether eating garlic before bed improves sleep quality. That specific claim, garlic as a sleep aid, simply isn't something the current research supports directly. What we do know is that garlic's effects on blood pressure and circulation, if they help you feel physically more comfortable, could indirectly support more restful sleep for some people. That's a reasonable inference. It is not a proven outcome, and I won't tell you otherwise just because it's what you want to hear. If your sleep problems are severe or ongoing, garlic isn't a substitute for finding out what's actually keeping you awake, whether that's a medical cause, a medication side effect, or something else entirely. So where does that leave us? Garlic's strongest evidence is blood pressure, with cholesterol and triglycerides a distant second. Immunity and gut health are promising, but early. Sleep, the thing so many of you care about most, doesn't have the direct proof yet. Which brings us to the part of this video I actually think matters most, because everything we've covered so far assumes you're someone who can safely add garlic to your routine in the first place. For a meaningful number of you watching right now, that assumption doesn't hold. Let's talk about exactly who needs to be careful and why. This is the part I'd ask you not to skip, even if you're eager to start tonight. If you take any regular medication, and based on what so many of you share in comments, a lot of you are managing several conditions at once, this section is for you specifically. If you take blood thinners, this matters most of all. That includes warfarin, aspirin used for heart protection, clopidogrel, also known as Plavix, or newer anticoagulants like apixaban or rivaroxaban. Garlic has natural blood-thinning properties of its own through a compound called adjone, which affects how your platelets stick together. Combine that with a prescribed blood thinner, and you're stacking 2 effects that pull in the same direction. This is a documented interaction, not common, but real and serious when it happens, raising the risk of unusual bruising or bleeding. If you're on any blood-thinning medication, talk to your doctor or pharmacist before adding regular garlic, especially in amounts larger than typical cooking. If you have surgery or a dental procedure coming up, the guidance is consistent across medical references. Stop garlic supplementation at least 1 to 2 weeks beforehand. This isn't excessive caution. There are documented surgical cases where excess bleeding during a procedure was traced back to patients quietly self-medicating with garlic. If a procedure is on your calendar, mention garlic to your surgical team the same way you'd mention any other supplement. If you deal with GERD, acid reflux, or a history of ulcers, raw garlic, especially crushed and eaten on an empty stomach, which is exactly what a lot of these bedtime routines suggest, can genuinely make things worse. It's one of the most commonly reported side effects in the research. If this sounds like you, cooked garlic with a meal is almost certainly the gentler choice over raw garlic before bed. If you take medication for diabetes, know that garlic may modestly lower blood sugar on its own. Add that to your prescribed medication, and there's a theoretical risk your blood sugar drops too low, particularly overnight, while you're asleep and less able to notice the symptoms. That's worth a specific conversation with whoever manages your diabetes care. A few other groups worth a mention. If you have a known garlic or allium allergy, this obviously isn't for you. If you're on certain HIV medications, particularly some protease inhibitors, garlic may reduce how well those drugs are absorbed. And if you're pregnant, nursing, or considering this for a child, the research simply hasn't been done thoroughly enough to make a confident recommendation, so check with your physician first. Now, a few mistakes I see people make, based on what so many of you describe trying. The biggest one is doing everything at once: raw garlic, lemon juice, cayenne pepper, apple cider vinegar, all before bed, all on the same night. Your digestive system, especially as we get older, doesn't always appreciate that many strong inputs at once. Start with garlic alone. Give your body a week or two before adding anything else. The second mistake is expecting overnight transformation, when everything we've covered tonight is about consistency over weeks and months, not one dramatic night. And the third, which matters most for those of you juggling several conditions, is assuming that because something is natural, it can't interact with your medications. As we just covered, that simply isn't true here. So let's bring this together. For most healthy adults, a small amount of garlic in the evening, even a single clove, cooked or raw depending on how your stomach handles it, is a reasonable, low-risk addition to an already healthy routine, with real, if modest, evidence behind it for blood pressure and cardiovascular markers. It is not a cure. It is not a replacement for your medications. And for some of its most talked about benefits, immunity and sleep among them, the evidence is still catching up to the claims. One more time because it matters. This video is for educational purposes only and isn't a substitute for professional medical advice, diagnosis, or treatment. Please talk with your own doctor before making changes, especially if you manage a chronic condition or take prescription medication. If tonight helped make things clearer, I'd genuinely appreciate you sharing it with someone in your life who's been curious about this too. And if there's a specific health concern you'd like covered in a future video, tell me in the comments. I read everyone's. Thank you for spending this time with me. I'll see you in the next one.